In this patient, we will be demonstrating about remplissage. Here we are doing a remplissage procedure to correct the Hill-Sachs lesion which is engaging. And here this is a Bankart lesion with a labral tear, and we are elevating it thoroughly and repairing it with the use of special anchors. Here we are using suture fixed anchors from Smith and Nephew to repair the Bankart lesion, and usually we need to use minimum 3 anchors. Normally we use 3 to 4 anchors for this particular purpose. Special suture shuttle relays are used to pass the sutures through the labrum, and we try to reduce it from the neck to over the face of the glenoid, thereby stabilizing the labrum and make the construct more and more stable. So by doing this procedure, we will be able to reduce the chances of redislocation. So this is a very good procedure. This is an arthroscopic procedure, and this procedure is a very good procedure to make the shoulder unstable in cases of Bankart and labral lesions. And this is the second anchor we put. And what we need to be sure, as we put the anchors, we go from inferior to superior. So we are going from the 6 o'clock position, 5 o'clock, 4 o'clock, 3 o'clock, like that. And we are gradually tightening the capsulolabral complex. And by tightening the capsulolabral complex, we will be able to shift the capsulolabral complex from inferior to superior position. So this way the labrum and the Bankart lesions are repaired, the shoulder becomes stable, and the humeral head, which is dislocating anteroinferiorly, can be stabilized well in this position. So this is the second anchor in position, and now we will be using the third anchor. The other thing we can appreciate here is there is a small part of bone fragment or a bony Bankart as well, which also is integrated into the repair as well. So this suture fixed anchor is an active deployment Smith and Nephew all suture anchor, which is considered as one of the best anchors if we are considering the repair of these Bankart and capsulolabral structures. So we can see here that with this third anchor also the rotator, this is repaired, the labral tissue is repaired nicely over its